there. Very warm welcome to everybody who's watching us today. It's great to see you all virtually. My name is Liz Lewis-Barnard and I am a GP in Gateshead, which is in the northeast of England. Best place to live in the world. And yeah, I really welcome you all to this course and I hope you're having a great time so far. So in the practice I work at in Gateshead, part of my role is, and actually one of the favourite bits of my role, is to run the mum and baby clinic. And I carry out the 6 to 8 week checks for both mums and babies. And I'm pretty passionate really about trying to make the appointment as much for the mums as it is for the babies. And my kind of mantra of happy mum and happy baby is one I like to live by. Really what I want to aim to do is talk a little bit about my role as a GP, both antenatally but also postnatally, like I said, in the 6 to 8 week check and beyond really. I guess a lot of what I'll be talking about today will be covered in more detail by some of the other speakers. So I guess my real aim is just so you're really aware of how my role, particularly as a general practitioner, comes into your care. So I guess if we kick off by looking at antenatally, how I might be involved. Historically, GPs were probably a lot more involved antenatally than they are now. The role of a GP has changed fairly substantially over the last sort of 10, 20 years. We used to be involved with quite a lot of, home deliveries and a bit more on people's pregnancy journey. But now you will notice really that most antenatal care is done by our amazing team of community midwives, who are often linked to particular practices, part of a multidisciplinary team. Everybody has their own roles, everybody has their own skills, and together we all complement each other. It will differ somewhat at each GP practice about how things on a day-to-day basis run. But certainly in my practice, we're very fortunate to have a fantastic midwife, and the communication between us as GPs and the midwifery team is great. We share information to ensure that our mums are best cared for. Where my role, particularly as a GP, comes into play in pregnancy is probably in a number of areas, really. So I guess if we just look at those in a little bit more detail, we can kind of think about how I might be able to help you best when you're pregnant. So firstly, lots of people come and tell me they're pregnant, which is amazing. It's one of my favourite consultations. They're normally a very happy time and a chance for me as a GP to look at health promotion rather than, I guess, treating something, because pregnancy is not an illness. I like to chat to women about healthy eating during pregnancy. I like to chat to people about what they can't eat. So all those nice things like camembert, red wine, which I really can't wait to have some of. There's sadly a big list of things which we should avoid during pregnancy. So I like to try and cover that. And there's a great list on the NHS website of probably foods that we should avoid to keep the baby safe during pregnancy. Also, we have a little bit of a chat about important vitamins. So you probably will be aware of folic acid, vitamin D, which is really important during pregnancy. And also just a little tip to you, don't worry about spending lots and lots of money on expensive vitamins. If you buy folic acid and vitamin D separately from the supermarket, it costs you about £2. So there's my money saving tip as well to you today. I guess one of the other things we do at the initial appointment when somebody tells me they're pregnant is talk about signposting you to the midwife and how to book in with the midwife. A booking appointment is normally done sort of 8 to 9 weeks, which is a long appointment with the midwife, asking lots and lots of questions and discussing any worries, any concerns, any risks, etc. So we'll talk about that. And again, each practice will differ a lot in how you book with the midwife. Some places, when you ring up saying that you're pregnant, might even say, oh, you don't need to see the doctor at all, you can just book in with the midwife. So it differs from area to area. One thing that I'm keen that people do discuss with me is if you've got any big concerns. So if you've had previous problems in previous pregnancies, to raise those early so that we can get your baby referred to the obstetric team, or have a chat about your main concerns, because pregnancy, whilst it's wonderful and very exciting, is a nerve-wracking time too. So I want to be there to be able to discuss your concerns and to be able to reassure you as well. Second reason why people might consult me antenatally is just common medical problems, really. Just because we're pregnant, even though we are super women, doesn't make us, I guess, be able to avoid common medical things. So coughs, colds, urine infections, chest infections. I still need to be able to look after you on a medical point of view. And so please don't hesitate to contact your GP if you're unwell, particularly in this COVID time. If you're worried, cough, fever, any symptoms at all, please get in touch with your GP. So another way that I'm involved commonly antenatally is my role as something called a gatekeeper, which, for instance, let me give you an example. If there's a lady that's fallen pregnant who may have a chronic disease such as diabetes or a thyroid problem, high blood pressure, I need to be able to help coordinate their antenatal care. And my role as a gatekeeper means that I have I'm able to refer to the appropriate midwifery team, to the appropriate obstetric team, so that that lady's care for both mum and baby during pregnancy is safe and ensures that we get the best outcome for mum and baby. I often am in phone contact or letter contact with our local obstetric consultants, who are excellent, and kind of act as the coordinator or advocate sometimes for patients as well. I guess the main examples of this are kind of chronic diseases like I said before, diabetes, high blood pressure. Another one would be epilepsy. We have to make sure that these conditions are very well controlled in pregnancy to ensure, best outcome for mum and for baby, and to make sure it's not a hindrance to the mum during pregnancy as well. Sometimes things can be a little bit more complex. We've got complex heart conditions, complex medication changes. And again, we work as a team between the GPs, midwives, obstetric team at the hospital to be able to coordinate this care effectively. And another way antenatally that somebody might come and see me is, I guess, common antenatal problems, really. The big one early on is the dreaded morning sickness. And those of you who are suffering with that at the moment, I really sympathise with you. I've suffered big time with it this time round, and it is grim. Do not worry about asking for help from your doctor, from your midwife, because there are things that can be done. It's a pretty long first 12 weeks if you're suffering badly with morning sickness. It's dreadful. So please make sure that you are discussing it with your healthcare provider. There are medications which are safe to use in early pregnancy. Lots of women are worried about using medications. Of course, we'd like to avoid medications when we can, but put it this way, cyclazine is a super drug that I got a lot of benefit from this time. It made me actually be able to function and to be able to eat and drink, which of course is important for a growing baby. So morning sickness, I see a lot of, and you have my full sympathy. Other common things, back pain, varicose veins, urine infections, all the delights of pregnancy. We don't get it easy, really, do we? Lots of pesky symptoms that we can do things about and certainly support you through those symptoms. So please ask. You don't have to cope by yourself. And our bodies are put through a lot during pregnancy, and if you're suffering, then you please ask us. There are lots of guidelines that exist for morning sickness, for back pain, and etc. In pregnancy. So there are things that we can do. Lastly, I think one of the common reasons that women consult me antenatally is mental health. Now, this is, I guess, more and more important, particularly in the last year, as a lot of people's mental health has been hit badly by lockdown and the pandemic. Mental health can be a little bit more fragile during pregnancy. We have the lovely surges of hormones to thank for that, and there has been a recognised rise of mental health problems as well, particularly in the last few years. Whether or not that's because we're more aware of them now, people are more happy to discuss them, but it's very, very important to discuss these early on, particularly if you've had a past issue with your mental health, so we can get on board and help you sooner rather than later. I guess one of the things we can get involved with is referring people to what we call the perinatal mental health team, which are a group of specialist nurses and doctors who are particularly trained to deal with mental health issues during pregnancy. From my experience from some of the patients that have utilised that service, they've done very, very well. The support's been excellent, and it's something which, if we can get on board early, then women often find that their mental health is more stable during pregnancy and afterwards. We want to ensure safety of mum and baby physically and also mentally. So I would really urge you, if you're struggling with any kind of mood disturbance or other mental health issue, to consult your GP early so we can get help on board for you. Absolutely nothing to be ashamed of. There is, I guess, still some stigma that does exist surrounding mental health, and that's really sad, because we want to try and empower people to look after their mental health and to seek help where it's appropriate. My overriding message about your mental health is, if you're struggling, please pipe up and get seen. So I guess that covers very briefly my role kind of antenatally. I think it's probably good now to move on to how my role in the postnatal period is. You'll find there's a huge spectrum between general practitioners of what's actually covered postnatally, depending on how your own surgery runs things. I'm extremely fortunate in my surgery. I actually have a dedicated clinic on a Wednesday afternoon that's only for mums and babies. Now, that won't be the same in every practice, but regardless really of how the check is done, I want today to just provide you with a little bit of information to empower you more, to help with things like shared decision making and with your GP, and to have a bit of confidence to raise any concerns that you might have postnatally. I think a lot of people think that the 6 to 8 week check is only for the baby, but I'm going to squash that rumour now. It's as much for mum as it is for the baby. Now, I could probably talk all day about postnatal checks, but I've kind of picked parts of the check today that I wanted to cover. Sometimes those things are a bit more embarrassing or hard to ask about. So I thought I would concentrate on those areas to, again, help empower you to be able to ask and not be embarrassed and not worry. Now, contractually as GPs, we have to cover various things at a postnatal check. So there are certain areas and topics which we must ask about. There was a change actually last year, it was last April, where again contractually GPs are now definitely supposed to run an 8-week check. Prior to this, sometimes maybe the health visitor or the nurse might have done it, but now it really should be a GP to perform the check. Something I'm quite a big believer in, because I think that if there are concerns, we need to be aware of it, and again coordinate that kind of multidisciplinary approach to women's care. Now again, remember that every surgery does things differently, and it might be that you get a letter from your surgery saying please book your baby check. It might be that you need to ring them yourself, but as long as everybody's aware that you should definitely, you're entitled to a 6 to 8 week check for both you and your baby, then hopefully you won't forget amongst the newborn haze. I wrote a letter, congratulations on the birth of your baby letter, that we send out to all mums now once we get notifications of birth, as an extra reminder, and also to say congratulations on an amazing period in somebody's life. So let me cover now a little of what the postnatal check involves. And again, I mentioned before, there are lots of other speakers today who are going to be covering some of this in more detail. I've solely concentrated on what I do as a GP. So number one, we're going back to mental health again. I cover this in a lot of detail postnatally with mums. Being a new parent is hard. It's the hardest and the best job. And you add sleep deprivation, a healing body, being a bit like a rabbit in headlights, and that's all can be triggers for somebody's mental health to, not be as optimal as we want it to be. Mood can really be affected, and sleep is the biggest thing that I find that seems to affect that in the postnatal period. This old saying of it takes a village to bring up a baby is a very true one, and one of my pieces of advice to you is, if you've got somebody that can look after your baby for a few hours whilst you get some kip, do it. I need to practice what I preach this time around with this little one and do the same. But yes, I think from a mental health point of view, sleep is really important. If you're feeling very low, tired, anxious, very weepy all the time, feeling that you're not bonding with your baby, anxious, crying at the slightest thing, then it might be more than the baby blues. So please discuss with your GP. Again, like I mentioned before, we've got access to the perinatal mental health teams. Each areas around the UK will have their own talking therapies, which you're prioritised as a young mum. In fact, if you've got an under 2, you'll be prioritised to much higher up the list. So there's not as much of a wait as there would be otherwise. You, as a GP, will be able to ask you the appropriate questions and do some screening to see whether we do actually think maybe you're depressed or whether this is the baby blues, and be able to offer support. Like I mentioned before, the talking therapies, the perinatal mental health teams, and sometimes medication. Not all the time, different for different people, different context, depends on your feeding regime, whether you're bottle feeding or breastfeeding. Sometimes that affects what choice of medication we will give you, but there's lots of options available, and the most important thing is to talk. So again, another take-home message from today is, if you're struggling with your mood, talk about it, get some help. Second area which we cover as GPs is contraception. You would think that having a newborn baby is the best contraception going, but no, the number of women I've looked after who've fallen pregnant very shortly after having a baby, I could probably count on 2 hands now. So it is something we discuss in quite a lot of detail. There is an absolute wealth of contraception available now, both female options and male options. It completely depends on the woman, their stage of life, their feeding circumstances, their age, so many variants about what could affect or what would be the best and useful contraception. And this takes quite a lot of time discussing contraception, because there are so many choices available to us now. The Faculty of Sexual and Reproductive Health have published a fantastic leaflet, which I'll forward you the link to on the email, which I'll send out, which basically is a big table with pros and cons of every contraception. And like I said, it's very, very different for each lady about what's acceptable, and what they would prefer. So it's about just having a discussion about contraception rather than being told this is the best contraception you can have. So again, something not to forget, but so you don't end up in a position where you've got too many people with a very close age gap if you weren't planning that. And like I said, I'll send you the link to this leaflet with the checklist that I'll send you later on. Now, as well as contraception, we often have a chat about sex as well. This is something that often people are very worried about postnatally and often very shy to ask about. So I will bring up the topic. Top tips: the 6 to 8 week check is not the all clear for telling you it's okay to have sex again. Many people will have had intercourse already when they come to see me, some maybe not, and some never want to be near their other half ever again. And so again, this is very different for every woman, and there's no right or wrong. It's a very personal decision about when you want to engage in intercourse again. And I think it's something that plays on a lot of people's mind. Will it be the same? Will it hurt more? Am I ever going to enjoy sex again? And all legitimate concerns, really. I think it feels quite embarrassing to ask about those questions as well. But, doctors have seen and heard it all, so you've got no, you don't need to be worried about raising these concerns that you might have. I think it is important, if you're ready to start having intercourse again, that we have covered the contraception bit, just so you're aware of some of the consequences of having intercourse again. This is especially important if you're bottle feeding, because actually your fertility can return actually 3 weeks after having a baby. Slightly fills me with horror, that. So we need to make sure that contraception is covered. I think it's a very good idea to have also discussed with your partner about sex post intercourse. It's something that women really worry about, and they worry particularly about they're letting their partner down. So I think, again, discuss with your partner any concerns and how you're feeling, and approach it together. It's a very important part of a relationship, part of a marriage, and also to remember what your body's been through. So don't give yourself too much of a hard time if at 6-8 weeks you don't feel ready to jump into bed again. Take it easy. There are, of course, other ways to be intimate with your partner, and it's about when you feel ready to engage in that as well. If you're worried particularly that it will be painful, if you've maybe had a tear, if you had a traumatic birth, then it's absolutely fine at your 6 to 8 week check to ask your GP to examine you if you'd like to be. I think that can be quite a reassurance to people. Say, yeah, look, it's healing. The vagina is an amazing organ that heals very well. And to kind of give you that bit of reassurance that you might need. But again, a bit like contraception, sex is one of those things. It's a very personal decision for when, how, and where, if you like, that's going to take place postnatally. I think take it slowly, take it easy, and when it feels right for you and your other half, that's when to engage. So we've covered sex and contraception. Let's have another look at something else, which I do cover in the postnatal checks now, which is feeding. Something I've learned professionally and as a mum is that there's still a lot of stigma regarding whatever mode of feeding you might choose to feed your baby, bottle or breast. I think mums feel guilty sometimes if they don't breastfeed, they feel under pressure to do so, and worry that they might get told off at their 6 to 8 check, like, why aren't you breastfeeding anymore? I am a very big believer that we should be supporting women, whatever method they choose to feed their baby. Now, we have no idea why somebody might choose to bottle feed over breastfeeding or vice versa. It's a personal decision again. We know that there are lots and lots of fantastic benefits to breastfeeding, and I would definitely encourage it if it's something that you are able to do. But if you're not able to, then you shouldn't be judged as a result by anybody, never mind a health professional. We need to be supporting you through it, and providing you with help, whatever that might be. So I've had women in tears sometimes in clinic that they can't breastfeed. Other mums and babies take to it like ducks in water. I think, like I said before, there are massive benefits to both mum and baby to be able to breastfeed, and a wonderful thing to do if you're able to. But if you can't, then you just really should not feel stigmatized or judged about it. Everybody is different, everybody makes different choices in life, and we shouldn't be judged on those. Particularly women who want support with breastfeeding, however, we can provide that. We've got some great breastfeeding support workers that exist throughout the country. There are some excellent online help, La Leche League, the Breastfeeding Network, which will be able to point people in the right direction for more support. Another of my top tips for you is, if you're breastfeeding, buy some lanolin cream for your nipples. In the early days, your nipples get very cracked and very sore, and breastfeeding is a bit of a toe curling experience in the early days. It settles down, but lanolin cream rubbed on your nipples after every feed is an absolute lifesaver. The best £9 I've ever spent in the chemist. So go and buy yourself some of that if your nipples are a little bit sore. The great thing about whatever mode you feed your baby is it's a great bonding time. If you're bottle feeding, you can still stare into their eyes lovingly and bond well with your baby. The same with breastfeeding as well. I guess one of the other great benefits of breastfeeding, something I'm looking forward to, is how much calories you burn off by breastfeeding. Although I'll probably end up eating lots of chocolate and cake and putting them back on. But breastfeeding is a great weight loss technique post-pregnancy as well. If you're struggling with feeding, please bring it up at your postnatal check. Bring it up much earlier when you visit a health visitor and your midwife comes to see you early in the postnatal period. Get some support. From personal experience, the breastfeeding support workers are amazing. I struggled with both my older two children to feed on my right, just didn't feel as comfortable as it did on the left, and their latch was a bit more difficult. Had some help from a fantastic lady who came to see me at home, showed me some new positions to feed, gave me some confidence, and didn't even bat an eyelid when she accidentally got breast milk all over her. But it was really, really helpful, and something that helped me continue to be able to breastfeed. Now, just quickly, because I'm running out of time, I want to discuss about wound healing with you. So cesarean, episiotomy wounds, stitches, something that most women can be concerned if they've healed properly. Now, it's not routine that we would examine you postnatally, but it's something that if you would like us to do so, we will, of course, if it helps provide reassurance and confidence. I think I mentioned earlier, the vagina is an amazing healing organ, got a great blood supply, it heals very, very well. And certainly by your sort of 6 to 8 week check, I would have expected things to heal. But if you're worried, if things are sore, if things don't feel right, get us to check, we can have a look. Alongside that, pelvic floor and bladder control, bowel control. I'm not going to speak about this in much detail because there are other speakers today that are going to cover this in a lot more detail than I will. But if you are struggling with any of the above, ask. This is the perfect opportunity to be able to raise your concerns. We can again signpost you towards pelvic floor exercises, specialist physiotherapy, sometimes even back to the obstetric or gynecology team if you're really struggling with either bladder or bowel control as a result of a traumatic labour. What I would do at the postnatal check is examine you at that point, so I've got a bit more of an idea about what's going wrong where, so we can help fix the problem and make the best recommendation of treatment for you. Other things that we might do, but not always necessary to postnatal check, is a physical exam, blood pressure, etc. Now, again, this is very context dependent on the person's antenatal issues, or if there were any. So if you had high blood pressure in pregnancy, I would be monitoring your blood pressure postnatally. If you had diabetes in pregnancy, I'd be monitoring and doing a blood test for you at your 6 to 8 weeks check. Again, depending on the various issues that people might have in pregnancy, heart problems, varicose veins, etc., etc. These will be things that I will be covering postnatal with you. But again, you wouldn't need to have a physical exam if there hadn't been any of those issues during pregnancy. So a low risk pregnancy with a smooth delivery, no complications, it's pretty seldom that any other kind of physical examination will be carried out. I want to mention one last thing, because I am rapidly running out, in fact gone over time, is driving after a C-section. Historically, you had to be given the all clear by your GP at your 8-week check that you were able to drive again. These days, the guidelines are a little bit more woolly. Essentially, if you've had a C-section and you feel able to do an emergency stop, then you can drive again. But my question to this is, well, how do you know without trying? Unless you go and jump in a car, drive around, try an emergency stop. I guess if we look at healing times, I would expect by sort of the 4-week mark that probably most C-section wounds have healed well enough that you're probably able to drive. But this is different for different people. If you don't need to drive, then let that wound heal for longer before you jump in a car. But again, people's circumstances, if you've got to do the school run, there are all sorts of things that kind of are variants about when people will jump in a car and drive again. But you don't have to wait till you've been given the all clear by your GP again. You do need to inform your insurance company, though, that you've had a C-section, that you're going to drive again from an insurance point of view. I think driving, if you can't drive due to your C-section wound, you kind of can feel a little bit more isolated, and then some of that might come into play with mental health, etc., etc. So we do need to be aware that driving is part of our independence, and again, depending on where you live, your access to things, the amenities close by, driving earlier for some women might be more necessary than for other ladies that can walk to lots of places that might have things nearby that they need to access. So a rather whistle-stop tour this morning of my role as a GP, antenatally and postnatally. I hope it's given you a bit more of an insight into things that we cover or get involved with antenatally and postnatally, and a bit of support, and just to get you thinking really about what questions you might want to ask when you go for your 8-week check. I hope after you heard me waffle on, you'll feel more confident to ask about maybe some of those more embarrassing things. And also kind of just what to expect at your postnatal check. Because like I said before, often people think it's mostly just aimed at the baby rather than the mum. We've covered loads about how the mum's involved today. So again, just let me kind of really hammer it home that checks as much about you as it is about the baby. Thanks very much for listening. I really hope you enjoy the rest of this fantastic event that we've all got the privilege of attending. And enjoy. Bye for now.